What is citalopram? Citalopram oral tablets is a prescription drug that's available as the brand name drug Celexa. It's also available as a generic drug. Generic drugs usually cost less. In some cases, they may not be available in every strength or form as a brand name version. Citalopram is also available as an oral solution. How should I take citalopram? Take citalopram exactly as prescribed by a doctor. Follow directions on your prescription label and read all medication guides or instruction sheets. Your doctor may occasionally change your dose. Measure liquid medicine with a supplied measuring device, not a kitchen spoon. Your symptoms may not improve for up to 4 weeks. Tell your doctor if you have any change in sexual function, such as loss of interest in sex, trouble having an orgasm, or in men problems with erections or ejaculation. Some sexual problems can be treated. If you stop using citalopram suddenly, you may have unpleasant symptoms such as agitation, confusion, tingling or electric shock feelings. Ask your doctor before stopping the medicine. Store at room temperature away from moisture and heat. Dosing information. Usual adult dose for depression. Initial dose 20 mg orally once a day. Maintenance dose 20 to 40 mg orally once a day. Maximum dose 40 mg orally per day. The initial dose may be increased if necessary to 40 mg once a day after at least 1 week of therapy. Doses of 60 mg per day did not demonstrate an advantage in efficacy over 40 mg per day doses. Acute episodes of depression may require several months or more of sustained pharmacologic therapy. Usual geriatric dose for depression, over 60 years of age. Recommended dose 20 mg orally once a day. Doses of 60 mg per day did not demonstrate an advantage in efficacy over 40 mg per day doses. Acute episodes of depression may require several months or more of sustained pharmacologic therapy. Contraindications. Citalopram is contraindicated with the concomitant use of monoamine oxidase inhibitors. Evidence suggests that concurrent use of citalopram alongside and monoamine oxidase inhibitors can result in serotonin syndrome, serotonergic hyperactivity. Symptoms of serotonin syndrome include rigidity, hypothermia, autonomic instability, mental status changes, and coma. Citalopram is also contraindicated in patients with a history of hypersensitivity to the drug. Precautions. It is very important that your doctor check your progress at regular visits to allow for changes in your dose and to help reduce any side effects. Blood tests may be needed to check for unwanted effects. The use of alcohol is not recommended in patients who are taking this medicine. This medicine may cause some people to become drowsy, have trouble thinking, or to have problems with movement. Make sure you know how you react to this medicine before you drive, use machines, or do anything else that could be dangerous if you are not alert or well coordinated. Do not take other medicines unless they have been discussed with your doctor. Side effects. Along with its needed effects, the medicine may cause some unwanted effects. Often none of these side effects may occur. If they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur. More common: change or problem with discharge of semen. Less common: agitation, blurred vision, confusion, decreased interest in sexual intercourse, fever, inability to have or keep an erection, increase in the frequency of urination or amount of urine produced, lack of emotion, loss in sexual ability, desire, drive, or performance, loss of memory, menstrual changes, skin rash or itching, trouble breathing.